We have detected a high number of candidates who became mothers during the 3 days of KCPE. If this is happening all year round, then the country could be facing a real crisis.
Mtihani wa jana kumaliza. Wengine walikusanyika wakaenda party. Wanasema wamemaliza kusoma wao, sasa wanasherehekea maisha.
Nanjala, not her real name, is a class 7 pupil in Kakamega. She's 8 months pregnant. The boy she claims is responsible is a Form 2 student. In spite of the stigma that comes with being expectant while still a child, in school she's determined to study and complete her primary education. She has the support of her grandmother who will help her raise her child. Other girls become social outcasts.
Most of them who get pregnant before they are adults, they are rejected in their homes. Linda Mama na Mtoto program. We support also youth who get pregnancy.
In Kenya, the youngest girl to give birth was 9 years old. According to KNBS, 26 in every 100 girls get married before they are 18. Child pregnancy in the country has been steadily on the rise. In 2016, the National Gender and Equality Commission released a report, Lost Childhood, the Drivers of Child Pregnancy in Kenya. This was after a public inquiry whose main objective was to establish the magnitude of child pregnancy in the country and make appropriate recommendations for managing the situation, both at the county and national government levels. 6 counties were sampled based on existing information on the prevalence rates of child pregnancy: Samburu, Busia, Nairobi, Nakuru, Homa Bay and Kwale. A total of 774 children were interviewed, with 130 randomly selected to testify before the panel. The child witnesses constituted both boys at 15% and girls at 85% of ages 12 to 18. The evidence was corroborated by focus group discussions with actors in protecting children and the experts' views on the subject matter. Kwale was on the red, with 23.8% of the child rate pregnancy. Kenya's average child pregnancy rate is 18%. Nakuru, Nairobi, Homa Bay, Samburu and Busia rank after. The common thread is that cultural and traditional practices are exposing girls to becoming child mothers and child brides. Culturally, a child was seen as someone below the age of 10. A girl with as much as fledgling breasts is seen as a young adult now. Tourism is the main allure of Kwale County. However, poverty among the local communities remains very high and education levels very low. Women are also accorded low status with limited capacity to make decisions. Marriages are contracted and consummated when the girls are still very young. Night discos, known as disco matanga, are also part of wedding celebrations.
Kwanza kabisa hawa wanafunzi wanapokuwa kwa sababu mimba haiji, inaanza kwanza uhusiano wa kimapenzi, na wazazi wengi hawakatazi watoto wao kuepukana na mapenzi ya mapema.
Early and forced marriages predispose girls to pregnancy. Forced marriages also extends to young boys who have impregnated young girls. Girls are seen as commodities, mostly married off for bride wealth.
Ndio umaskini ni tofauti, but inategemea ni umaskini ya aina gani. Unapata elimu pia iko chini upande wa Kwale kulingana na mtoto kisichana. Na pia unapata hiyo pia inachangia, maana hawajui jinsi ya kujilinda, hawajui jinsi ya kujilinda wenyewe kama watoto wasichana.
Mimba za mapema inasikitisha kwa sababu unaweza fika katika boma na unapata mama hiyo boma ni mtoto, hata pia yani anafanya mambo za kitoto.
But the challenges are not unique to Kwale. What the statistics reveal is suggestive of other factors contributing to child pregnancies. This include increasing child-to-child sexual experimentation, defilement, lack of sex education, widespread poverty, lack of parental guidance and counseling, cultural taboos that inhibit sex education, unavailability of contraceptives or the low uptake, lack of proper parenting, use of mobile phones, and double standards in how boys and girls are taught to socialize. According to the Kenya National Bureau of Statistics, 37% of girls and 44% of boys between the ages of 15 to 19 have already had sexual intercourse. But what do we do with the statistics?
I have asked my Quality Assurance and Standards Department to work with relevant departments to investigate the extent of this situation and give me a report for further action.
The recommendations given include leadership and political goodwill, ratifying protocols for the rights of the child, rescue centers for abused boys and girls, female role models, and advocacy and awareness programs. Nanjala is protected by the Basic Education Act of 2013 that enables her to still go to school even if she's expectant. And even after her child is born, she's protected by the 2009 National School Health Policy that is expressed on the re-entry of girls who have given birth in school. It's now a wait and see whether the new investigation ordered by the Education Cabinet Secretary will find anything different from what was already researched and reported. Dorcas Wangera, Citizen TV, Nairobi.